Evidence to action. Let's talk about disability data. CYDA's Key Statistics Report, a transparent and accessible approach. Research team, Dr. Tess Altman, Policy and Research Coordinator at Children and Young People with Disability Australia CYDA. Stephanie Dimov, Research Fellow and PhD candidate at the University of Melbourne, School of Population and Global Health. Caitlin Blanche, Lived Experience Contributor and Reviewer. We asked Steph, what did the partnership with CYDA enable that you couldn't have done in a university-only project?
Partnering with CYDA gave the project a kind of grounding that I really valued. So there was always a clear so what around developing this report, a real, working with a real organisation like CYDA. They're working with real families, real young people, and there was a genuine need for this resource to actually land and be very, very useful. So there was sort of a very practical element to developing the report. It also gave me a much clearer picture of who we were making this for. So working with CYDA, who are actually on the ground, working with young people, working with families, meant that the audience never felt abstract to me. And it also kept me accountable in a good way as well. So having CYDA in the room or me being able to attend meetings or ask questions meant that I was always thinking about the gap between what the data was showing and then what people were actually living and experiencing as well, which is something I try to do often in my academic work. But that tension is very important, and this partnership actually often kept that very front of mind for me. And then on a very practical level, CYDA brought knowledge that I just didn't have. So what questions was the sector sitting with? What already existed? Where were people hitting walls, trying to find and use this kind of information? And so that was genuinely invaluable to the project, I think.
We asked Steph, where is disability data currently doing harm or reinforcing poor assumptions?
So one of the things I found myself thinking a lot about was how we collect data and how it shapes what we're really able to see. So a lot of the existing data sets reflect a very sort of medical model framing. So disability tends to be captured in terms of what a person can't do rather than what barriers exist or what support might make a difference for them. And I think severity classifications are a very good example of this. So labels like profound or severe are useful shorthand in some contexts, but they also carry assumptions about capacity that don't always hold up. And then there's also a question of how data gets aggregated as well. So when everyone is with disabilities grouped together, findings can end up being quite broad, and the real diversity that exists within that population can get lost. So that really matters because experiences are genuinely varied across different people with different types of disabilities. And then there's also the question of who's missing from the data altogether. So there are certain groups that aren't well represented in the sort of the publicly available data that we have in Australia, and that absence has real consequences. So it can make it harder to make the case for designing certain services or policies that meet their needs, and people with complex support needs or that use alternative forms of communication are probably the clearest example of that.
What is something about disability data you think most people misunderstand?
One assumption I kept coming back to when developing this report was the idea that more data automatically means better understanding of something. And so what I found was that it really depends on the foundations. So if the frameworks or the definitions aren't quite right, or if the right people haven't been involved in shaping that process, more data can actually end up reproducing some of the same gaps at a larger scale rather than really filling them. So there's also something worth sitting with here around the assumption that publicly available data is comprehensive. So the gaps are actually quite substantial. in the publicly available data. And when I say publicly available, that's to sort of people in the general community that might not have academic ties to a university like I do, for example. And so these gaps tend to cluster in particular places. So these are often around the experiences that are hardest to capture, but are certainly most important to understand. And so I think it's really worth naming that data isn't neutral. So even if it can feel that way sometimes, so every data set reflects decisions about what to measure, how to define it, who to ask, and what to do with the answers. And so those decisions are made by people and institutions with particular perspectives, and that shapes what the data can and can't show. So recognising that isn't really necessarily a criticism, it's just part of using the data well and being transparent about what the data can achieve.
What types of data are most needed but hardest to find?
Clearest gaps that I kept coming back to and thinking about when putting together this report and gathering the data and looking at some of the statistics was around longitudinal data. So we have reasonable snapshots of what's happening at particular points in time, but we have very little data that actually follows children and young people with disability through key moments. And those might be moments like leaving school, moving out of home, that kind of thing. And so those transitions are often exactly when things can get very complex for people and have sort of long-term effects on people's lives. And so it feels like that's a real significant absence. There's also a gap around outcomes that actually matter to people. So this is something that certainly working with CYDA has illuminated for me, and in some of my some of the work that I do, the qualitative work that I do, and some of those things that matter to people around quality of life, social connection, having a say in how you live. Those are things that people will often talk about rather than just service use or clinical measures. And so we don't have very good sort of measures or data on those things that matter to people. And those things are definitely harder to capture, but they're often what people are most concerned about, which I think is important to acknowledge. And then there's a question of who's really falling outside of the systems that we do have data on. So children and young people who aren't on the NDIS, for example, who aren't in mainstream education, who are in contact with the justice system, they often don't show up in administrative data, which means that their experiences can be really hard to see from a policy perspective. And I think one of the things that I'd love to see more of is data on barriers. So not just participation rates, but the why behind that and those rates. So what people tried, what didn't work, where they hit walls, and that context is often missing and is often very essential.
What are the key gaps you identified in the data? What's missing or not visible?
The most consistent gap that I think we identified when looking through the data for this report was around intersectional data. So there is some data on children and young people with disability as a broad group, but there's far less about what it's like to be a First Nations young person with disability or LGBTQIA+, or living in a regional area. And those combinations of identity and experience are largely invisible in what's publicly available. And then children and young people as a specific cohort also tend to disappear in data sets that focus sort of more broadly and might be sort of more inclusive of adults or the sort of entire lifespan, or that only report on disability in general population terms. So the experiences of younger people are often systematically underrepresented in the publicly available data. And some experiences just don't get measured at all. So things like informal exclusion from school activities, or the emotional labour that might fall on families when systems aren't working or collaborating as well as they could be. These are significant, but they often sit outside of what data collection is designed to capture.
How well does current publicly available data capture intersectional experiences?
Most of the national data sets that report on disability do so as a single characteristic. So that means that the compounding effects of multiple identities are largely invisible. You can find out that someone has disability, but you can't usually find out what it means to navigate that alongside being First Nations or being trans, for example, or living rurally. And where that intersectional data does exist, it tends to be very thin. So often, if we're thinking about some of that publicly available and navigating to some of those sections, the sample sizes might be quite small. There's often very broad categories, or it's presented as sort of an add-on rather than something that's integrated into the main publicly available report or analyses that have been conducted and shared. First Nations experiences in particular are probably the most consistently underreported. So there are specific data collections that try to really address this, but they're not well integrated with the sort of the mainstream disability data that we were able to find that was publicly available. And so then you end up with looking at parallel systems or data sets that don't really talk to each other. And then gender diversity was another element or another factor that was particularly poorly captured. So most of the data sets still use binary sex categories that we were able to talk about in our report, but it meant that those experiences of people that were trans or gender diverse, of young people with disability, were essentially absent from the publicly available data, and we had to make notes about that in our report. And then culturally and linguistically diverse communities also face a different but sort of related problem on this front. So disability is understood and experienced differently across cultural contexts. And so in terms of the data that we collect, the data collection methods don't often account for that. And so we'll systematically sort of undercount or misrepresent those experiences often. And so, we were finding that there were some gaps often across the intersectional experiences that we were able to report on from the publicly available data.
How do definitions of disability affect what we see or don't see in the data?
Definitions shape everything. So definitions shape who gets counted, what kinds of disability are treated as real or significant, including invisible disabilities. And all of this follows from how disability is defined at the point of data collection. And then there's also the question of self-identification as well. So not everyone who lives with disability will use that label, particularly in communities where disability might be more stigmatized or it's understood differently. And so if the definition doesn't resonate with how people understand their own experiences, they often won't tick that box. And so the data ends up reflecting not just who has disability, but who is willing and able to be counted within a particular definitional framework. And so those aren't the same thing, and that difference definitely matters.
What did this work reveal about how publicly available datasets don't speak to each other?
There are integrated data assets in Australia, like the National Disability Data Asset, or the NDDA, that can link across data sets and give a much richer picture of what's happening for people with disability. But access to those is restricted to a relatively small group of researchers with the right institutional approvals. And so for everybody else, especially those in the community like families or advocates, community organisations like CYDA, and many researchers, publicly accessible data is all that there is. And even when that data does exist across multiple public sources, building a coherent picture is very difficult. So different data sets might use different age ranges, for example. They might use different definitions of disability or different reference years as well. So you're essentially trying to piece together a puzzle where the pieces don't quite fit. And so that's a real limitation for anyone that's trying to make the case for policy change. Those working in advocacy organisations, for example, because it's difficult to show the cumulative or the compounding picture that might exist for people with disability, and especially for children and young people with disability. And so you can show fragments, but often not the full story.
How can qualitative and lived experience data strengthen or challenge what the numbers show?
So quantitative data can tell us that something is happening, that a gap exists, for example, that a rate is high or low, but usually it can't tell you why, or what it feels like, or what would actually need to change. And this is where lived experience data or qualitative data does something a little bit differently. So it surfaces what some of those mechanisms are, so the things that don't quite fit neatly into a category, the experiences that don't show up in survey responses, for example, that might be leading to why some of these gaps exist or what we could be doing differently. So in the context of this report, one of the clearest examples is probably unmet need. So the quantitative data gives us a figure, but it's the qualitative and the lived experience evidence that probably is going to be more likely to tell us what it actually costs families to navigate a system that isn't working for them. And so there's also a validity argument here as well. So the data that hasn't been stress tested against lived experience is more likely to contain assumptions that might distort that picture. And so bringing quantitative and lived experience evidence, or having lived experience input in the analysis or understanding of that quantitative data or qualitative evidence, makes both of these stronger in my opinion and experience.
If you were starting a new research project, what would you do differently in response to data?
By genuinely auditing what exists and what doesn't. Definitely not assuming that I know the landscape in any way, especially with how quickly things are changing on that front, but actually really mapping it first, including what's been produced by advocacy organisations, for example, and community groups where there are some great surveys being developed and shared, and sort of thinking out of the academic box, or just, not just thinking about academic sources, for example. I would also involve people with disability much earlier in the decisions about what to measure and how. So definitely not just as a consultative step at the end, but as design input from the beginning. And that's where definitions really do get shaped. It's where the most important decisions get made about what we're going to be looking at, how we will be essentially measuring that, and what some of the data is that we'll be looking at to answer some of those questions we've come up together. I'd also be more explicit in my methods and findings about the limitations of the data that I am using. So this is not necessarily sort of a defensive footnote, but as a more genuine part of the analysis. So if a particular group isn't visible in the data, that is definitely worth naming and definitely worth being transparent about, and also explaining why that matters as well. Is a sort of a real opportunity to do that. And I'd also think harder about accessibility from the start as well. So who will actually be able to read and use what I produce? And so that question should really shape the format, the language, and the framing from day one.
What is one thing that needs to change about how we think about disability data in Australia?
So we need to move from treating data as something that gets produced about people with disability to something that gets produced with and for them. So that is a really significant shift, and it's not just rhetorical. It has real implications for who is involved in data design, what gets measured, and how those findings are used. So the current system reflects the priorities and assumptions generally of the institutions that built it, and those aren't always aligned with what people with disability actually need to know or be able to show or want to know. And this is especially true for people with intersecting identities. So the data tends to treat disability as a single characteristic when the experience of being First Nations young person with disability or a young woman with psychosocial disability is shaped by multiple overlapping factors that the current system largely can't see. And so and for people with complex support needs or alternative communication needs, they are among the most underrepresented often because the dominant data collection methods just simply don't work for them. And so, if participating in data collection requires completing a survey that you can't access or answering questions in a format that doesn't fit how you communicate, you will be left out. And that's not just a technical problem, it's a participation and it's a power problem, and the solution has to involve structural change to enable those people to be to participate and for us to have appropriate data that they themselves can access.
What are 2 to 3 practical things researchers can do right now to improve how they work with data?
The first is to audit what already exists before you start. So, not just what's easy to find in academic databases necessarily, but this could also include what's been produced by advocacy organisations, community groups, and people with disability themselves. So, a lot of important work sits outside of the places that researchers typically look. The second is to be explicit in the methods about the limitations in the data that you're using. So again, this is not a defensive footnote, but it's a genuine part of the analysis. So if you can't see a particular group in the data, say so and say why that matters. Naming that gap is actually very useful and very important. Pretending it isn't there isn't. And the third is to think about accessibility from the start. So who will actually be able to read and use what you produce? Are you designing for them? That means plain language, accessible formats, and being clear about what your findings mean for people, not just for other researchers.
Evidence to action. Let's talk about disability data.